sir. Am I audible?
Yes, now it is audible. Now it's very clear.
Thank you, Dhanesh sir. Thank you, MK Sani sir, for giving me this opportunity. And without wasting any more time, I'm just going to share my screen first.
Yes, you can share now.
Yes, sir.
Yes, now it is better to adjust your camera a little more so that we can have a good view of you.
Is this better, sir?
It is better to raise your face a little more. Okay.
Yes.
Okay.
Sir, so good evening, everyone. Good evening, everyone from everywhere in the world. And so I'm looking forward to learn a lot of things here. And I hope I would be able to provide some new insight.
Yes. Yes, I think the network is left due to network failure there. Please wait for some minutes so that she can rejoin and yes.
Hello, sir.
Yes, now we
Yes,
can.
sir. Yes, sir.
Have you shared the screen?
Yes, sir, I have. Is it visible?
No. We cannot see the screen now. Please,
One second.
please reshare so that we can see.
Yes, sir.
Stop sharing and then start resharing.
Okay, sir.
Yes, now it is visible.
Yes, sir. So I would like to give a brief introduction regarding me and my guide. So I'm Dr. NIMISHI Sisodia, and currently I am an MD PGR at Department of Psychiatry at Swasth Kalyan Homeopathic Medical College and Research Center, Jaipur. And my guide, Dr. Chandraban Sharma, he is MD Homeopathy Psychiatry and PhD scholar and Associate Professor at Department of Psychiatry at Swasth Kalyan Homeopathic Medical College and Research Center. So moving forward to today's objective of this session. So first, we are going to understand what are alcohol use disorders, what are the various motives of drinking for a person or a patient, what are the prominent effects of alcohol on the CNS to develop a neurological disorder. Then we are going to learn about and discuss about the common remedies for the alcohol use disorder. And then we are going to discuss about the modus operandi of various medications like Nux vomica, aconite, arsenic, gelsemium, phosphorus, pulsatilla, sulfur, on the heart rate variability and the blood flow variability on body. Next, we have modus operandi of opium, modus operandi of ruta and phosphorus medicine, modus operandi of lycopodium clavatum, and finally, the physiological action of homeopathic drugs on human body. So, before understanding everything, we first must know what is alcohol use disorders. So, according to DSM-5, which is Diagnostic and Statistical Manual of Mental Diseases, and ICD-10 book, alcohol use disorders can be defined as a problematic pattern of alcohol use which leads to significant impairment or distress in the three sectors of life. First is on the physical plane, second is on the social plane, and third on the psychological plane. Each and every plane on these three bases is impaired for the patient. Biologically, physically, the patient suffers. There are various comorbidities, alcohol or any other substance. It leads to a lot of comorbidities and affects almost every body organ. On the social plane, the person suffers socially. There are different circumstances. There are hindered relationships. His work is affected. His personal relationships are affected. And third is psychological plane, where the person is in continuous state of anxiety and distress. And there are various other psychological causes. So here are the number of listed symptoms of alcohol use disorders, like drinking more or for longer periods than intended. There are failed attempts to cut down or control the use of alcohol, spending a lot of time in obtaining and using recovery from alcohol, craving alcohol, developing tolerance, withdrawal symptoms are experienced, drinking in hazardous situations, indulging in hazardous activities that might disturb one's life. Both DSM-5 and ICD-10 emphasize on the impaired control of drinking. ICD-10 defines alcohol use disorder under two categories, which is harmful use and dependence syndrome. In India, almost 27.3% of men and 1.6% of women consumes alcohol, and almost total 14.6% of the Indian population aged between 15 to 17 years uses alcohol, and it causes its misuse further causes both acute and chronic illnesses that can even be fatal. Now we are going to talk about the motivations of drinking. Why does a person even drink? This is very important to understand because if there's no motive, the person is not going to indulge in any substance abuse. So, when we are going to talk about motives of drinking, as you can see this image, this diagram, this ray diagram, this is a conceptual model that explains the alcohol use based on one individual's expectancies, motives, behaviors. So, I'll break it down into different parts. First, we can see the precursors of individual expectancies, historical factors, which is like personality traits, biochemical reactions to alcohol, socio-cultural influences, and the current factors in one person's life. For example, availability of alcohol to drink with peers, which affect again the alcohol related expectancies, which are shaped by the interaction between positive and negative incentives for a person. Then there are two type of expectations that people form for drinking alcohol or consuming a substance. First is direct chemical effect, that is expecting positive effects of alcohol, which means expecting drinking is going to enhance the feeling, or a state of euphoria is going to be generated. Second is indirect instrumental effect, which means that a person expects that drinking is going to enhance the enjoyment or positive incentives, or it is going to reduce the negative incentives or the impact of alcohol. Third is the balance of expected effects. People generally expect in general that the alcohol is going to enhance the positive effect or reduce the negative effect or the mood of the person or the behavior of a person. And the last one is source of expected effects, which can be internal, which can be external. Internal, which comes from within the individual, such as emotional state, or external state, for example, peer pressure or social influences. So ultimately, we can come down to four drinking motives that arise from these expectancies. First is enhancement, which can be positive or internal. Second is social, which can be positive or external. Third one is coping, which is negative and internal because the person is trying to cope up with his environment. And fourth one is conformity, which is negative and external. And these motives, these four motives, ultimately you lead to using of alcohol. The whole model connects the cognitive processes, motivation, and external influences to explain why any individual or a patient consumes alcohol in first place. The second is now we need to understand what the effect of alcohol is on the central nervous system and how it is developed as a neurological disorder in a human. So, alcohol, like any other addictive substance, increases the release of dopamine, which is a neurotransmitter, as we all know, associated with the pleasure and reward system of the brain. So, this is secreted in the brain's VTA, which is ventral tegmental area, which is a part of mesolimbic dopamine system. It is involved in motivation and reward behaviors. So, when alcohol is consumed by a person, dopamine is released into regions like the nucleus accumbens, and the alcohol consumption appears to be more appealing to the person. Various studies have shown that repeated exposure to the alcohol leads to changes in the brain, enhancing the reward based learning and contributing to addiction. Because once a person takes the alcohol, he feels rewarded, the brain feels it is rewarded, and it becomes a series of patterns, and the person continuously starts taking alcohol. Although alcohol does not target any directly target any dopamine receptors, and its effect on dopamine are influenced by the interaction with other neurotransmitters as well, such as glutamate, GABA, GABA, corticotropin releasing factor, 5-HT serotonin, which we call serotonin, and the other endogenous opioid systems in the brain, for example, endorphins and anthophylins. Again, in the brain, the neuron activation depends on the balance between the excitatory and the inhibitory neurotransmitters. We can say the alcohol inhibits the NDMA type of glutamate receptors, which are excitatory in nature, and increases the GABA receptors activity, which is inhibitory, resulting in overall neuron suppression. However, in the chronic scenario, in the scenario of chronic alcohol exposure, the brain adapts and it increases the excitability of neurons by enhancing the NDMA receptor activity. This ultimately changes the glutamate signaling, which can make the brain more responsive to the drinking cues, and it ultimately leads to addiction, which we call as alcohol use disorder. So after this, if a person he stops using alcohol, there is an imbalance created between the glutamate, which is excitatory in nature, and the GABA, which is inhibitory in nature. And this leads to hyperexcitability, which can cause the withdrawal symptoms like anxiety, trembling, disbalance in the body. These changes in the GABA system contribute to the discomfort of the withdrawal, and this can last long after someone stops drinking. It lasts for days. The urge to relieve withdrawal symptoms may drive people to relapse and drink alcohol again, and the whole loop is connected again and again. Now, as you can see in the diagram, the liver is affected, the brain is affected, and the blood-brain barrier is affected. I'm going to explain this to you in a gist. So, alcohol metabolism leads to the production of harmful metabolites, especially like acetaldehyde, which can cause damage to the blood-brain barrier. Blood-brain barrier, what is blood-brain barrier? Again, it is the protective structure formed by the brain microvascular endothelial cells, which is connected to the pericytes and the astrocyte cells of the brain. And it maintains the brain homeostasis. So when this homeostasis is disturbed and the alcohol and its metabolites enter the brain, they increase the blood-brain barrier permeability, which initiates the neuroinflammation system in the body. Alcohol again is mainly metabolized by the liver by the enzymes such as alcohol dehydrogenase, which is ADH, and cytochrome P450, E21. This enzyme produces acetaldehyde, which is further broken down into acetate. However, alcohol metabolism generates reactive oxidative species, which we call as ROS production. Chronic alcohol exposure exacerbates this damage, increases this damage, leading to the increased reductive oxygen species production and inflammation, which ultimately harms the neural cells of the body. Oxidative stress also disrupts the tight junctions of the blood-brain barrier, allowing the toxic substances to pass into the brain. This leads to brain edema, inflammation, and neurodegeneration. So, chronic use of further alcohol increases the release of low inflammatory cytokinins such as tumor necrosis factor alpha and IL-6, interleukin 6, contributing to the permanent nerve damage and impairing the cognitive function of a person. Over time, alcohol-induced damage to the blood-brain barrier and the brain cells can cause long-term neurodegenerative diseases like Alzheimer's and Wernicke's-Korsakoff syndrome, which again is a very common comorbidity of alcohol. Ultimately, alcohol metabolism disturbs the BBB integrity, promoting neuroinflammation, which causes the cascade of cellular damage in the body, contributing to the various neurological disorders. As you can see in this diagram again, there's demyelination of the neurons, neural generation, and ultimately cell death also. Now, I am going to put some light on the common remedies used by alcohol use disorder. So as you can say, I've color coded this. The remedies from 1st to 14. So there's this uh, homeopath called John Perry. So in his book Alcohol and Homeopathy, he writes about these 14 medicines, and he says that these 14 remedies are the most prominent remedies that one can use for alcohol use disorders. And the remedies from 15 to 22 are these remedies which can be used for prophylaxis, as a prophylaxis for alcohol use disorder. So a child who has a family history of alcohol use, or a child who has been exposed to alcohol at a very young age, these medicines can be used in the treatment. The remedies from 23rd to 42 are the general medicines for alcoholism, which we read in the various repertories and the various materia medicas. And 43 to 48 are the various mother tinctures that we use in alcohol use disorders. Now, we are going to let's talk about the modus operandi of homeopathic medicine, the basic philosophy of homeopathy, what Dr. Hahnemann gave us, that how does homeopathic cure takes place. So he says, we all know this, then when a medicine is applied homeopathically to a sick person, they the morbidity, the range vital force of the individual through the medium of changes in the nerves. Then a stronger similar medicinal disease is produced by the primary action of the medicine, which is known as the artificial disease. This artificial disease, which is stronger similar medicinal disease, permanently extinguishes the weaker similar one, which is the artificial disease. And the vital force is now merely medicinally diseased. And this medicinal disease is removed again because of the stronger dynamic affection. Now, these medicines gradually become weaker and weaker due to the first minuteness of the dose of the medicine, and second, the shorter and fixed duration of the action of medicine of the medicinal agent. And second is the second curative action of the vital force. The vital force is again restored, is free from the disease and the medicinal forces, and being free from all the diseases, the vital force is again able to carry on its healthy vital functions and work normally. And the health is restored. This is what we have been reading how the homeopathic cure takes place according to Dr. Hahnemann. Now, I am going to put some light in the next slide about the various modus operandis of various homeopathic drugs in a more scientific manner. So, first medicine which I'm going to put light on is Nux vomica. To understand this research, first we need to understand what the writing reflexes are. So, writing reflexes, understand these that writing reflexes are the set of involuntary movements that allow any organism to maintain or regain its upright posture and orientation in space after it is displaced. These reflexes are very crucial to maintain balance and posture and coordination in animals, also humans. So, this study on Nux vomica, there have been extensive research on Nux vomica, but I've picked up this one. So the study was conducted on male adult albino mice, where Nux vomica 30 was administered in a potentized form. The drug was mixed with sterile distilled water, about 0.05 ml, and given orally at the dose of 0.05 ml per mouse. The control group received an ethanolic extract of Nux vomica seeds, which 90% of alcohol in the ratio of 1 is to 100, followed by its sonification for 30 seconds at the speed of 20 kilohertz. This process was then repeated through 30 steps to create the Nux vomica 30C potency. 6 hours after the treatment, the mice were injected with 25% of alcohol accordingly to the 4 gram per kg body weight, and the sleep duration was recorded from loss of restoration of writing reflexes. The experiment involved 4 sessions with treatment given in the following order: control solution. First was control solution. Second was Nux vomica given orally. Second was Nux vomica injected peritoneally in the brain. And the shortest sleep time was observed with Nux vomica, while Nux vomica, which was injected in the brain. And the treatment showed up no, while the other significant, there was no significant observation made by the another other mode of administration of the drug. In the second experimentation, Nux vomica 30 was prepared using both distilled water and pure ethanol. These preparations, along with the Nux vomica prepared with 90% of ethanol, were tested on mice. Results indicated that the orally administered Nux vomica significantly reduced the alcohol induced sleep time, likely due to its action on oral receptors. Previous studies were also done and they showed that Nux vomica decreased alcohol consumption in rats but only through oral administration, suggesting that the drug's effect may be mediated through receptors in the oral mucosa. Ethanol and water molecules in the Nux vomica might have been interacted with the mucosal receptors, specifically the three nerve endings. These three nerve endings respond to a variety of stimuli. The effectiveness of the Nux vomica also was enhanced when it was administered with alcohol greater than 90%, which is crucial for homeopathic was effective in reducing haloperidol induced catalepsy in mice, where the preparations with pure pure water or ethanol were ineffective. Ethanol and water formed a binary azeotropic mixture where the molecules are held together by hydrogen bonds, influencing the structural integrity or the properties of the liquid. When a drug like Nux vomica was added to this mixture, the interaction between the solute and solvent occurred, which altered in the structure of the solution. Even as the solute particle diluted in the higher potencies, solvent molecules retained the structural memory of the solute, which was potentially reorienting ethanol and water molecules. This reorganization underlined these Nux vomica's specific effects. As you can see, this is the treatment sleep time in minutes after the treatment was given. It was compared, the control group was compared by the Man Whitney test, and 33 prepared with 90% of ethanol in reducing the sleep time 34% significantly. The p value was less than 0.01%, which means there was a significant difference. Next, there was a research in which the effects of aconite, arsenic, gelsemium, phosphorus, and pulse and sulfur was seen on the heart rate variability and the blood flow variability. This exploratory study was investigated and the effects of various homeopathic medicines was observed in 77 healthy individuals using the medical analyzer system. And physiological changes were recorded before and after administering these following remedies. And this was compared to placebo. The heart rate variability and the blood flow variability responses were analyzed on the basis of low, medium, and a high frequency peak with significant changes defined as a 100% increase in 50% decrease in the peak amplitude. I'll show you. These are the two tables which show the response in HRV and BVF after intervention. So as you can see, Aconite Nepalus 30C significantly affected the heart rate variability, while its 1M potency influenced the blood flow variability. Gelsemium 200, pulsatilla 200, and sulfur 200 produced about 62.5% change in the heart rate variability compared to 16.6% in the placebo group. Gelsemium 1M, phosphorus 1M, and sulfur 1M had a similar effect on the blood flow variability. Also, the placebo had very minimal effect on the blood flow variability. The study also suggested that the homeopathic remedies can selectively affect the heart rate variability at low potencies and the blood flow variability at the higher potencies, indicating that the specific autonomic responses were also observed after giving these medications. Next, I would like to put light on the modus operandi of opium medicine. So, opium is used in both modern medicine and in homeopathy, but the approach is very different in the both pathways. Opium acts as an alkaloid that affects the CNS, and this particular study, tested the various homeopathic dilutions of opium on mice CNS as and compared them with pentosine, which is a common painkiller we use in allopathic medicine. So 40 mice were divided into the groups of 7 to test the opium dilutions, which were in the potencies of 6C, 30C, 200C, 1M, and 0 by 1 LM potency, along with a control group and a pentosizine group. The effects were measured using three tests, which is acetophotometer, second is analgesiometer, and third is Straub test. The acetophotometer was used to observe the locomotor activity. The analgesiometer was used to assess the pain response, while the Straub test was typical for testing the opioid effects. The results showed, as you can see, that the homeopathic dilutions do not have as same effect of the opium. And interestingly, the potencies of 30C and 200C dilution shows a high CNS stimulant effect, suggested that they might have counteracted as a CNS depressant, which cause CNS depression, which is caused by alcohol. And this is same as the homeopathic principle. How these testing methods were conducted, it was using three parameters. First is locomotor activity. The mice were placed in a chamber with sensors that recorded their movement for 10 minutes before and after giving the drugs. The changes were observed in their movements. Second is hot plate method, in which the mice were placed on a hot plate at 55 degrees Celsius to measure how long it took for them to respond. Like the mice started licking their paws or started jumping. This was recorded before and after giving the drugs at different time intervals. For example, after 60 minutes, after 30 minutes, after 120 minutes. The time was limited to 30 seconds to prevent the injury. I'm sorry, 30 seconds, 60 seconds, and 120 seconds. And the time limit, it was limited to 30 seconds to prevent the injury. The results and the third one was for the opioid activity, which is Straub test. The mice were injected with the drug, and the reactions were observed for 30 minutes. If the tail rose up at the angle of 45 degrees, it was considered as a positive result. So, as we can see, in the modern medicine, opium and its derivatives act like morphine, which is a painkiller, and it binds to the opioid receptor to relieve the pain. They also treat conditions like cough, fevers, and spasms. In homeopathy, we use opium for conditions like coma, extreme sleepiness, and constipation. While both the system use opium poppy seeds preparations, and but still the system effects were significantly different. The significant difference was also seen on the locomotor activity. CNS depression was most prominent in 6C and 1M potency of the alcohol group, likely due to CNS depressant effects, and higher dilutions like 30C and 200C showed that there was less CNS depression, supporting the homeopathic concept that higher dilutions increased potency. And the results were based on three criteria. First is opium's chemistry. Opium comes from the poppy plant, which contains severe, again, morphine, painkiller like substances, which have its effects on brain, spinal cord, and it relieves the pain. In homeopathy, opium, again, significant differences were seen in the activity of the mice of the different groups. And it was seen that the analgesic properties of opium were not established. It was more prominent in the pantosizine group. So this study concluded that it has a more pronounced effect on the locomotor activity and less as an analgesic. Third is the modus operandi of medicines like ruta and phosphorus. The study evaluates the effect of homeopathic preparations on hepatocellular carcinoma, which is induced by N-nitrodicyclonide (NEDA) in rats, and sarcomas, which were introduced by 3-methylcholine 3-MC in mice. The homeopathic remedies ruta, hydrestis, lycopodium, and thuja were tested for their potential to reduce the liver tumor formation and inhibit the development of sarcomas. This whole study involved two models. This is one which was NDA-induced HCC in Vista rats and 3MC-induced sarcoma in the Swiss albino mice. The rats were divided into six groups. First was normal control. Second was NDEA tested treated control group. Third was ethanol vehicle control group, and the fourth treatment group is given NDEA along with Ruta 200C, Lycopodium 200C, Hydristis 200C, and Thuja 200Cs. These homeopathic remedies were orally given for 5 days a week for 20 weeks, and the mice were divided into three groups ultimately, 3MC groups. The Ruta 200C plus 3MC, the Phosphorus 1M plus 3MC, and these both remedies were administered following the induction of sarcomas. Morphological, biochemical, and histopathological analysis was done and were performed to assess the liver tumor development, enzyme levels, and the tissue changes. As you can see the results, the phosphorus treated mice developed tumors, and the survival rate were higher in the treated groups with 14 out of 20. The phosphorus treated and the 9 in the phosphorus treated group and 9 out of 20 Ruta treated mice survived at 30 weeks. This another table shows the effect of the selected homeopathic drugs on the level of serum and liver gamma glutamate and the serum GSH. In the NDA treated rats, tumor nodules were observed in the liver control animals. Ruta 200C treated rats showed fewer nodules and retained normal liver morphology with only few necrotic masses. And the serum and liver enzymes markers such as gamma glutamyl transpeptidase, alkaline phosphatase, which we call ALP, and the transaminases GPT and GOT was significantly elevated in the NDEA control animals. These enzyme levels were reduced by homeopathic treatment with Ruta, showing that the highest reductions of the histopathology and that the Ruta prevented carcinomatous changes in the liver, while other remedies showed milder effects comparatively to the Ruta medicine. Next, we have modus operandi of Lycopodium clavatum. Lycopodium clavatum, commonly known as the club moss, it is used to mostly treat the digestive issues, muscle cramps, urinary problems, and rheumatic conditions. In folk medicine, it also has been applied to nervous system disorders like epilepsy. However, its use for homeopathy and CNS in homeopathy has been not very much explored. Sorry. So this study explored the analgesic and behavioral effects of the Lycopodium clavatum in the Vista albino rats to examine its potential as CNS depressant activity. Rats weighing about 120 to 140 grams were treated daily with various potencies of Lycopodium like 3x, 6x, 12x, and 30C for 30 days. As you can see in the results, the analgesic effects of Lycopodium clavatum on a hot plate test. After 10 days of treatment, the rats treated with 3x potencies showed a significant increase in the time taken to respond to heat-induced pain, suggesting its high analgesic effects. However, this effect was diminished by the 30th day. In the second ice place test, similarly, rats treated with 3x and 6x potencies had delayed responses to cold stimuli on the 10th day, with effects tapering off by the 30th day. And the third, which was Randall's stiletto test, which was pressure on the rat paws of the rat. The rats treated with 3x potency showed an increased pain threshold to the mechanical stress on the 10th day itself, but its effect lessened over time. If we are going to talk about the effect on behavior of Lycopodium clavatum, it was done using a rotor rod test. The rats were treated with Lycopodium showed reduced grip strength, especially at the 3x potency, indicating the CNS depression activity. This motor impairment began to reverse by the 30th day, suggesting the potential adaptation of the brain. The second was open field test. The Lycopodium treatment reduced the locomotor activity And similarly, like the rotor-rot test, this effect was diminished by the 30th day. This study concludes that the Lycopodium clavitum significantly has a significant CNS depressant activity and increasing in the pain thresholds and reducing motor coordination activity. However, prolonged use reduce the effectiveness, likely might be due to the CNS desensitization or increased duct clearance for the due to metabolic adaptation of the brain. Next, we are going to understand the physiological action of the homeopathic drugs. This is a proposed model. This diagram, this slide shows a proposed possible mechanism and pathway of action of drugs, homeopathic drugs on human body, how they act. So, when a homeopathic drug are administered on the tongue, they stimulate the nerve endings that send signal to the hypothalamus to the autonomous nervous system or the central nervous system. This stimulation of hypothalamic neurons trigger a series triggers the neurosecretion, leading to the direct nerve signal transmission or the release of hormones from the endocrine glands. These hormones, whether they are steroidal or they are protein based, they have the potential to influence the other glands or to form the hormone protein complexes that regulate the gene expression. According to the widely accepted written and Davidson model, this hormone protein complexes may activate certain specific sensor genes, which in turn initiate the transcription of the adjacent integrator genes. Again, these integrator genes products then interact with the receptor genes to control the expression of the producer gene, which is analogous to the gene regulation in the prokaryotic cells. Gene activation can also be seen according to the Jacob-Montel model, which in where the protein acts as the repressor and de-repressor to control the transcription of the DNA. Prim- uh, Previous experimentations were done, and as we have seen, a lot of data is also unpublished, but they suggest that the homeopathic drugs can alter hormone and enzyme levels in a human body, which can potentially influence gene expression to repair the chromosomal damage. It can be, it was also given on a lot of cytogenetic and hematological studies. So, three main DNA repair mechanisms, which is um, photoreactivation, excision repair, and post-transcriptal repair, may also be involved in this whole process. These mechanisms ultimately suggest that the homeopathic drugs trigger gene controlled repair processes in X eradicated mice. Gene regulation can occur through several pathways, including first is gene amplification, second is structural changes in the DNA methylation, histone interactions, post transcriptional regulation, and the cell cycle alteration, and the immune system reactivation. Studies show that the homeopathic drugs can also affect that the mitotic division in the bone marrow cells and in the mice, and this supports the immune system activation. The homeopathic drugs affecting the mitotic division in the bone marrow cells and the chromosomal repair may also be involved in extending the life expectancy in the patients of cancer, indicating and this indicates their role in the gene regulation. Also, homeopathic drugs may correct the transcription errors caused by the viral infections, such as which is demonstrated by the antiviral efficacy in animal models, which further supports their influence on the gene expression. So we can see through these various modus operandi or these extensive research which has been done using various homeopathic medicines that we can establish some connection between the modus operandi of homeopathic medicine on the philosophical point of view as given by Dr. Hahnemann, and also there are scientific evidences which shows the similar effects as we have seen in this study on opium medicine, that secondary curative action was seen. and Nux vomica also, that the complex between water and ethanol was formed, which absorbed by the tongue affects the whole genes and endocrine system. So we can say there's a lot of research is yet to be done. We have to study the modus operandi of various other drugs also. But in specifically alcohol use disorder, the role of homeopathic drugs is impeccable. We can see impeccable results in the treatment of alcohol use disorders. Thank you so much. I'm going to conclude my presentation here. And in the end, I would like to thank first of all the IFPH for giving me this opportunity, this platform for collaborating and promoting homeopathy. Second, MK Sahani sir, who gave me this opportunity here. I would also like to thank my college, Swast Kalyan, for giving me this opportunity. My guide, my HUD Chandraban sir and Swarupananda Sarkar, who has given me invaluable
Thank you, Dr. Nimishi Sisodia. It's really a wonderful session. You show the beauty of homeopathy remedy.
presentation. My principal, Dr. Yogeshwari.
Hello.
Yes, sir.
Congratulations, Dr. Nimishi Sisodia. It's a very good session indeed. And really, it
Thank you so
shows
much.
the power of homeopathy in managing all those conditions which are supposed to be incurable. But the homeopathic medicine, the modus operandi of homeopathic medicine in management of alcoholism is something great. And you have shown some remedies, how it works and how it acts on different situations. And all those things were beautifully narrated. What's your opinion on syphilinum in those conditions? Usually it's a syphilitic miasm that is working. That's the reason why people who used to take alcohol in a big way by doing much damage to their home as well as to the society.
Yes, sir. Sir, personally, in my research, I have seen impeccable results of ciplaninum. But again, unfortunately, I was unable to find any research that supports the or shows the modus operandi, how exactly ciplaninum works in alcohol use disorders. It works very nicely. We have seen the results, but again, how to present or how to confirm those results, we need more extensive result or more scientific evidences for the same. We as a homeopath, I believe we have this personal responsibility to have that mental itch to find more and more, and we need more animal models and we need more human models to give the scientific evidence for the same.
Definitely, in those conditions, you can undertake a research on that aspect also. Because your team can do such wonders because a lot of research work is going on under the National Homeopathic Research Council. As CCRH is doing a lot of work.
Yes, sir.
We have a CCRH and hospital in Kottayam, Kerala.
Yes, sir.
There a
Yes,
lot
sir.
of works are doing on this particular phenomena.
Yes, sir.
And those who want to have a chat as well as want to have a question or want to clear your doubt or have to add something more, can please raise your hand so that we will allow you to unmute yourself and you can speak to Dr. Nimishi Sisodia. Please. Is there anyone? Dr. Boblin, are you there? Have you gone through this session and you can make your comment here? Oh, yes. Yes, Dr. Manoj is here. It's a very
Thank you, Dr. Tanesh. A nice topic. And I think this is a contemporary important topic. Students from the very school session, they are engaged in alcoholism. Not only in females, but males, but also females. So to address such a problem with a medicine like homeopathy, a safe medicine, a scientific medicine, a proved medicine, without harming the patients. So much contemporary relevance, and congratulations. Also, you studied a lot of things. You can give proper reply to those who are always crying for the scientific evidence, even though none of the evidence in the medical science is scientific because they're always changing. You know what happens, each and every medicine they are bringing the marker that they were well studied, but after within a few 3 years or 5 years, they have to abandon the medicine. Without any, there is no scientists there, even the vaccines are there. So anyway, it's a nice presentation. Also, what is more relevant, I think, is that the education you got, that is most important. About this, the postgraduate psychiatry, it itself indicates that we need more courses, more super specialty courses, more fellowship courses, so the intelligent students can study and work together for a long time. That will further enhance homeopathy. Thank you.
Thank you. Sir, I think as a homeopath, we lack this case because, again, the lack of knowledge, we did not study a lot of scientific evidence. It was a learning for me as well while reading about this topic, and I got a lot of knowledge about various remedies and how they scientifically work. So, again, we need a lot of extensive research to prove ourselves and to prove the efficacy of homeopathic medication. We see it in practical, again, the theoretically part, scientific evidences, we lack it.
Yes,
We
the
greatly
basic
lack it.
problem is that who will fund it? It requires a
Yes,
lot
sir.
of fund. Nobody is
Yes,
there. At the
yes,
same
sir.
time, crying for no studies, no results, no this or that. But who will fund it? That is the main
Yes,
question. Yes.
yes.
Yes. Yes. Now it is up to Dr. Bob Lim from Malaysia to speak to Dr. Nimishi.
Uh, I uh, I think Dr. Nimishi has done very well tonight by presenting her research, and proven scientifically that homeopathy remedy works,
Thank you.
and they can change the DNA inside the cells also. There has some power or potency in homeopathy that can move the cell DNA to work for the recovery and the healing process. I think that is a very good thing that we should keep on the record for evidence based, because many people does not know the concept of how homeopathy medicine works. So when they always think about the allopathy concept, it's very hard for them to accept how homeopathy remedy works. I think your case presentation tonight is very good because you presented it in a very, very deep form and in a very, very scientific form. And congratulations to you. And I hope that you will keep connected with the CCRH for your papers and to keep it on the archive and record, and maybe perhaps you can put it in several of the homeopathic journals. Thank you very much.
That also is a very good comment. And now it's up to Dr. Ramparisa to say a few words on this.
Thank you, Dr. Dhaneji, and congratulations, Dr. Nimishi Sisodia, madam.
Thank you so much,
Very
sir.
nice presentation. Alcohol use disorders and very kind subjects, medicine like opium, homeopathic medicine, primary action to secondary action, opium, so physiological action, use of homeopathic drugs. Very nice presentation. Thank you. Very, very thanks.
Hariharan sir, do you want to speak to Dr. Nimishi on the subject? Please unmute.
I am not listening the speech, so I don't know which subject is.
Oh, okay, sir. Okay, sir. No problem. No problem. She has shown the beauty of homeopathy in some of our medicines in treating alcoholism and how it works, and that was the beauty. Really, it's a very good session indeed.
Well, Dr. Dhanesh, this this idea, Hanuman gives a special mentioning on that. First, you convert the patient by using wine. Those who are using this brandy or whiskey, you must force them to use wine. Then you have to add some more water to the wine. Then gradually tapering those. We can reduce the addiction with our medicines. I think it is mentioned in chronic diseases. Thank you.
That's a very good news indeed. Very good
Very.
idea. Yes, Dr. Nimishi, do you want to say anything more on the session? Please share your number also, because we want to have some more presentation in the future also. Okay. And then now I invite Dr. Boblin to say a vote of thanks to the session.
You invited me, Dr. Dhanesh?
Just a vote of thanks.
Oh, yeah. On behalf of the IFPH, I am Bob Lim from Malaysia. I would like to express my sincere thanks to Dr. NIMISHI Sisodia for presenting a good research and cases on this 1,489 daily webinar on this Saturday, 28 September 2024, which is a very, very good presentation and very scientific. And I hope that she will continue to present more research and more cases, especially if you can maybe research on other remedies like Naxmomica or Zinc for the alcohol-related disorder. There will be a wider option for us. And once again, thank you very much, and I hope to hear from you in the very near future. And over to you, Dr. Dhanesh.
Thank you, Dr. Boblin. And thank you those who participate in the session also. And thank you once again, Dr. Nimishi Sisodia, for such a beautiful day sessions here. And tomorrow we will have a session from tomorrow we will have a session from Dr. Shalini, and she will be talking about the diabetes mellitus and its homeopathic management. Yes. Thank you, Dr. Nimishi, once again.
Thank you. Thank you. Wow, wow, wow.
It's over to Dr. Vishaila to moderate the Malayalam session. Thank you all.
Okay. Thank you, Dr. Dhanesh. Thank you all doctors in English